Good morning or good afternoon. Good evening. We see some walking, probably some eating for the ones that are in Europe, but we'll give it two more minutes and wait before we start. One minute more, and then maybe we start slowly. Maybe we should write an email with the access code, secret code. Okay, can you make it full screen? It's in the, yes. Please. Okay, I think that's also the right moment. People are still joining, but I can start a bit slowly. We, as a quadripartite technical core group working on antimicrobial resistance, would like to welcome you to this fourth webinar to present the One Health Priority Research Agenda for Antimicrobial Resistance. This is the fourth webinar that we do. We started with a general one, showing the top 10 priority questions, and then we started pillar by pillar to go a bit deeper into each of the topics and the results. Today, we will speak on intervention. We have 5 panelists that will be presented later on by my colleague from FAO. And while we are presenting, my name is Elisabeth Erlacher-Windel. I worked a long time as the head of the Department on Antimicrobial Resistance in the World Organization for Animal Health. And I'm now senior advisor for the same organization, mainly focusing on antimicrobial resistance research. I would also like to introduce my colleagues, Francesca and Jorge, while we are sorry that from UNEP they couldn't attend today. So maybe I'll start with Francesca. Francesca, please.
Thank you very much, Elisabeth, and welcome everyone. So my name is Francesca Latronico. I'm working at FAO in the AMR team, and I'm working as AMR laboratory and research activity coordinators. Over to Jorge.
Thank you, Francesca, and good day, everyone. I'm Jorge Mateo from the Global Coordination and Partnership Department in the AMR division and WHO headquarters. Over to you, Elisabeth.
Thank you very much. So again, welcome to everybody. We have some rules here, but before we start with the rules, I would just make a short reminder. Some of you have been to other webinars, so I will keep this very short. But why do we do these webinars? We have, as a quadripartite, 4 organizations are engaged in the One Health aspects of antimicrobial resistance. But so far, while each sector has its own agenda on research, we didn't have something like this on cross-cutting issues. So we started to think that when we came up with questions that we had ourselves for our work, that it might be useful and interesting to look at this all together. So that's why we came up with this One Health priorities as a research agenda, and the focus is on One Health. And another focus is that we, while interesting for all the countries, we really would like to have a look at on the low and middle income countries, because that they have maybe started later can learn from the errors that have been done elsewhere. And we really think that might be of interest, especially on research questions. So far we have in many topics and undertakings, we have used the best guess ideas, what we thought would be the right thing to do, where to start with, but we didn't have done a formal exercise on prioritization. So we really hope that this research agenda will provide us answers and help us on a global level to look at these One Health quite new topics, to see how we can work together, not only in the implementation, but starting by the research. So I will not take too much time, because I also have to give you the rules that you also already see on the screen. So please keep your microphone on mute. We know that some of you might be hungry and eat or walk or whatever, so you can look that you have maybe taken off also the camera. Please, if ever possible, rename yourself with the organization and country followed by your name. That would make it easier for everybody to recognize where you come from. And then the speakers will present their own views, not the formal views of the organizations. Please don't advertise services, company, or commercial products or brands. So we have a question and answer session that will come after the panel session. We would like to ask you to pose your questions after the panel session, so that you will listen and maybe some of the questions will already be answered during this part. So there is a question and answers box here. So please post them after the meeting. We have a lot of attendance, so we will try as much as possible to answer. And you will also have our names on the screen, so that you can contact us afterwards, and we can also link the contact to the panelists. And last not least, we have a quadripartite website where this webinar will be available. So the meeting is recorded, and this will be posted on this quadripartite website after the meeting. And with this, I will hand over to Jorge, who today will present the results of the intervention pillar of the research agenda. Jorge, over to you.
Thank you so much, Elizabeth, and thank you for joining, everyone. I will present the results of this specific pillar on interventions. Just to remind you that the One Health Priority Research Agenda was focused on 5 pillars: transmission, integrated surveillance, and interventions that we will present now, and behavioral insights and change, economics and policy. And also we have cross-cutting themes: gender, vulnerable population, and sustainability. You can also find the previous webinars in this website that I'm showing you, but I will also share during this webinar. What I will share with you is the background of this specific pillar on interventions, the aim and scope, the top priority research areas for interventions, the methodology, and the next steps. Also to highlight that this research agenda was developed, funded on the definition of One Health that was developed by the One Health high-level panel in 2021. And One Health is an integrated, unifying approach. It recognizes the health of human, domestic, and wild animals, plants, and the wider environment are closely linked and interdependent. This approach mobilizes multiple sectors, disciplines, and communities to work together in contributing to the sustainable development. How was developed this One Health Priority Research Agenda? So this is part of the second strategic objective of the Global Action Plan that was launched in 2015. Is also part of the recommendations of the report of the Interagency Coordination Group for AMR in 2019, and also included in the Quadripartite Strategic Framework launched in 2022. This report on this research agenda was launched last year in June. So you can find it and review and see the different research areas that we identify. What is the aim of this research agenda? Is to catalyze interest among researchers and donors on One Health AMR, to provide direction for investment in One Health AMR with focus on low and middle income countries, and identify and prioritize research areas at the interface between One Health sectors that will inform policy and practice relevant evidence for countries. The scope, this was a global exercise. I will explain more when I present the methodology. Is focused on the interface between the One Health sectors and the microorganisms, the AMR microorganisms focus on this agenda are bacteria, parasites, and fungi. And the time frame is aligned with the Sustainable Development Goal frame for 2030. Out of the scope on this research agenda is research on and development of new antibiotics, antimicrobials, and vaccines, diagnostics development, and research related to only one sector because there's a development of specific research agendas for the specific sectors. This was the process. I will explain later the specific methodology, but we determined the research area through literature review, academic inquiry, literature review, global open call survey, and expert input. Then, based on this analysis, we proceed with the prioritization exercise with a group of experts using the Delphi method, and then the report that was launched last year. Specifically on interventions, this pillar is focused on programs, practices, tools, and activities designed to prevent, contain, or reduce the incidence, prevalence, and circulation of AMR, including optimal use of existing vaccines and measures at the One Health interface. Some of the things that is important to mention that we found that most of the intervention commonly implemented include clean and sustainable production and consumption of chemicals, water sanitation and hygiene, WASH measures, biosecurity and infection prevention and control on farms and healthcare facilities. However, we have still some important gaps, especially understanding the availability of potential technical interventions and implementation in low and middle income countries. For this pillar on interventions, we identified 13 research areas presented in 4 categories. I will explain each of them. 5 on methodology development, 3 on operational research, 4 on evaluation, and 1 on framework conditions. Let's go one by one. So for methodology development, we have the first 2 research areas that basically is how can research capacity in low and middle income countries can be strengthened to catalyze locally tailored collaboration and cooperation between the One Health sectors, and what priority tools and frameworks can assist tailoring of One Health interventions for national AMR action plans. The other 3 areas on methodology development is the criteria, which criteria should be used to assess interventions that aim to prevent and control AMR in the One Health interface. What mix of evidence and evaluation is needed to understand how to implement One Health AMR solutions, especially in low and middle income countries. How could implementation research be systematically incorporated into the design of One Health intervention for AMR in low and middle income countries? On operational research, we have how can One Health intervention that have proven impactful for AMR control and mitigation be translated in a scale up in different contexts and different settings? How can existing health and food production system be effectively integrated and enhanced on One Health AMR interventions? And what are the minimal resources interventions to support and improve national integrated multi-sectoral One Health surveillance systems of AMR and AMU. On evaluation, the challenges that exist to systematic collection and analysis of data for risk assessment and intervention impact assessment in low and middle income countries. And relative impact, what has been the relative impact of AMR occurrence of infection prevention control, farm biosecurity, food safety, WASH, and integrated pest management measures. The last on evaluation, what has been the most impactful interventions to prevent, control, and mitigate AMR at One Health interface, and what has been the impact on AMR across One Health sectors on nationwide interventions, like vaccination and others. And the last on framework conditions, how can we improve early adaptation and innovation for the prevention, control, and mitigation of AMR across the different sectors, especially again in low and middle income countries. Let me just share a bit about the methodology. You will find in this research agenda 62 priority research areas that were prioritized in the 5 pillars, 13 in this pillar on interventions. As I explained previously, we have this academic scoping review that was conducted from January 2020 to December 2021, a global survey with around 1,600 participants, and then a great literature review and survey analysis. The result of the academic literature review and the global survey was the analysis was used to conduct this prioritization exercise with 89 experts that used the Delphi method that included 3 rounds of analysis, then a final expert discussion of results and the publications that you already have. Each of the experts, we provided a criteria for prioritization. It's part of the Delphi method. And the 5 criteria was if the research gap identified was important, was inclusive, strengthened research capacity, was impactful and actionable. In this specific pillar on interventions, we have 19 experts in the first round, 18 participated. We provided 28 research questions, and each question was rated against the 5 criteria that I presented previously. In the round 2, we have 15 out of 19 experts, and we provided 19 research questions. For this second round, the criteria were, just 4 of the criteria were used. Importance, the criteria on importance was dropped. In the last round of the Delphi method, we have the 19 experts that participated in this pillar, and 15 research questions were provided, and they selected the top 10 that you find in the report. The discussion, the final discussion with the experts was decided the final set and wording of 13 research priority areas in this pillar. The reporting category is established to provide guidance on sequence and potential impacts, and experts strongly prioritize evaluation of and prioritization tools for existing One Health interventions. What is the next steps? So we are disseminating this report through these webinars, but also we are contacting and working with donors, experts, and the scientific community to get this engagement and commitment to implement this research agenda. We are also working with our regional and national country offices to disseminate and also attract more donors to provide support and implementation of these research areas identified in this agenda. And also we are working with our interdisciplinary multisectoral research networks, collaborating in reference centers, and scientific and research community. The next webinar will be on March 6th. We will also share the invitation soon. And we are going to cover in this next webinar the pillar on behavioral insights and change. Thank you very much, and over to you, Elizabeth.
Thank you. Thank you, Jorge. I think that we can go directly. If there are burning questions, we still would like to ask you to wait for the question and answer session. But I think the best would be to go to the panel discussion, and I will hand over to Francesca.
Thank you very much, Elizabeth and Jorge. So now we go to the panel discussion. So just to remind you, it's a panel discussion, so the panelists have not been asked to present slides, so you will not have a slide that you can see. So it's our pleasure that today we do have 5 panelists, so just like lining them up. So we have Dr. Tracy Moraya, Professor Tim Bachmann, Dr. Christina Osbeer, Professor Tong Zhang, and Professor Helen Lambert. So we start one by one. So the first one to get the first question, it is Dr. Tracy Moraya. So Tracy is the head of the policy and strategy at REACT Africa. Her background is in pharmacy with a specialization in global health policy. And its role at REACT Africa focuses on engaging with policymakers and different stakeholders at regional, national, and local levels to both advocate and support implementation of health system strengthening intervention with a special focus on antimicrobial resistance in the sub-Saharan African countries. So Tracy, for you, the first question is, how can One Health intervention that have been proven impactful be translated in different resource settings?
Hello, everyone, and thank you, Francesca, for the warm introduction. So I have 4 minutes to address a very general question. I'll do my level best. So for me, really, the best way is a healthy mix of bottom-up and top-down approach. One may look at it as an end-to-end sort of approach. And the key thing here is that whatever end product that may come out of the translation in the different resource settings should ensure that the mechanisms that are put in place are actually sensitive to the unique challenges and needs of the different regions that the interventions are being adapted to. And not only that, but also focus on the inclusivity, yet effectiveness, while providing timely recommendations so that the AMR stakeholders involved are actually able to take it up and impactfully change or bring about a behavior change that's needed. So if I were to look at examples that we've been involved in at REACT and also others that we've seen in the region. So let me start with, for example, at REACT Africa, we have involved elementary school children at level of between ages 10 to 13. Yeah. And this, it's called the Alforja Educativa. It's a guide that was developed in Latin America, in our offices back in Latin America. And so we took it and decided, why not try and see whether this can actually work in Africa, and specifically in Kenya, where I'm based. So we took the guide, and before doing anything about anyone, the first thing is we involved the national AMR coordinating body in Kenya. Why? Because together, you know, under the Ministry of Health, you find this coordinating body. And so what we needed was a buy-in, first of all, and we're coming, you know, quote unquote, as we say in Africa, you're coming into someone's home. So you might as well knock at the door first so that you get that approval and commitment and buy-in. And once we had this on board and we had informed them this is what we want to do, then together with one of our implementing partners, went to two counties or regions, we call them counties in Kenya, in the western part of Kenya, and engaged key stakeholders, meaning the Ministry of Education, Ministry of Public Health, Ministry of Health as well, and more importantly, even the school administrators and teachers. What they did is to, so we engaged them in sort of a formative research type of approach, where it was more focus group discussion and key informant interviews, where they were able to give us the situation on ground. And if we're coming to actually engage elementary school children as agents of change to bring about awareness, understanding, and just the general behavior change around antimicrobial use amongst their households and communities, this is the way we must go. So we were able to engage the children successfully. They came up with little kitchen gardens, which they associated as one, improving their nutrition, two, meaning that they're not, sick all the time and going to the hospital or even drug shop to get antibiotics, well, through their parents, of course. And even through these kitchen gardens, they also planted trees, because through the intervention, they were able to understand that the environment is key in ensuring that, we have a healthy ecosystem that really balances out all the microbial situation and microbiome per se. And even other intervention or other methodologies that they came up with as a children, playing football or soccer matches, and they're able to also tell their peers what happens. And this really was a success, because even the parents at the very long run were happy and encompassed us in their different communities, that we were also able to, unfortunately not to our best expectations, but we were able to also start putting in place tippy taps for washing hands, so that then this translates to better infection control, less antimicrobial use, and so on and so forth. Then if we look at, and I'm glad to see FAO being represented here, in Africa, the farmers school that has been implemented in about 4 or 5 countries in Africa, where we find that they did not just go on ground and prescribe what needs to be done. Instead, they took up the farmers from the different sectors, especially poultry, and really even the questionnaires that were being formed, the interventions that were being put in place were driven by the CAP studies that had been done. And you're able to then put in place also indicators that make sense to the stakeholders that you're approaching. So what do these two have in common? While you're able to even bring a product in place and then show it to the policymakers, who could be technocrats or politicians, you're able to gain a deep understanding of the context and then build capacity rather than teach the stakeholders on what to do. And then now, from a top-down approach, you go to the policymakers with these well-packaged interventions. If it's to the finance minister, then it should be packaged in cents and dollars. If it's to the agricultural minister, then it has to make sense in terms of, return on investment of their farmers, meaning that then the policies can be translated to appropriate guidelines and frameworks that ensure integration of the intervention methodologies in the day-to-day practice of the target population. And maybe finally, I can say there has to be an effective monitoring and evaluation framework with pragmatic targets and indicators. For example, what we find, the SDGs have actually created an exemplary M&E platform for the globe, where the member states are able to, give their feedback through the voluntary national platform. Or even if we come down to AMR, surveillance, there's GLASS, there's the tracks, or even M&D frameworks at national level for the different NAPs. And then now this encompasses a constructive feedback mechanism or information exchange between peers, as we're seeing now with what has come from the MAP study in Africa, where now the 14 countries are able to exchange surveillance information and the know-how, the skill, etc., to be able to actually ensure that there's a sustainable quality, continuous actually quality improvement in place. And I want to stop there. And also just encourage us also, apart from that, to really look at the media engagement. I know we haven't done a really good job there, but we really need to engage the expertise that we find amongst our journalists. They're able to storytell and humanize really complex situations, yeah? And at the same time, bringing and amplifying expert opinions, such as those that may be found in this platform. And that way then, not only are the bottom population able to understand, but even the top technocrats and policymakers are able to understand what is needed from them by the citizenry. Thank you.
Thank you very much, Tracy. And yes, indeed, I think that, well, it's important that to try something, but also like there to keep recording like what can, I mean, the procedure, so then can be learned or like can be applied in some other places. So now we go instead to Till. So Professor Tim Mackman is the professor of molecular diagnostic at the University of Edinburgh, where he also leads the AMR strategy and chairs the Edinburgh AMR Forum. He also co-directed the Fleming Fund Fellowship Host Institution program there. He fulfills several advisory roles worldwide, including also the chair of the Scientific Advisory Board of the JPI-AMR, and he's a founding member of the BEAM Alliance Diagnostic Task Force. He's an experienced network coordinator and an expert of point-of-care diagnostic, and he is a strong proponent of transdisciplinary approaches to tackling AMR in One Health and global health context. So, Till, again, welcome. And then for you, the question is, based on your experience, what does it take to implement successful multi-sectoral One Health intervention in the field? And if any, what would you do differently so far?
Thank you so much, Francesca. I gather you can hear me. And it is really a fantastic opportunity, and thank you so much for the invitation. I would underwrite, to start with, I would underwrite everything Tracy has said, and actually it is a little bit difficult to expand on that. So I will give a few more examples maybe, and let me take a step back and think about what do we actually want to achieve with interventions. We want to prevent AMR, we want to optimize antibiotic use, and actually I think we need to think about that with the whole AMR scenario, with interventions, we can have an opportunity for innovation. So it is a challenge, it is a threat, but it is also an opportunity, for, as I say, for innovation. Again, so if you think about what it needs for implementation, we need to, again, put ourselves in the context. It's a One Health scenario. So we have the humans, the animals, the plants, and all of us are in the environment. It's really important if you think about what it takes to have successful implementation. And if you think about the animals, we always think or tend to think about livestock, think about companion animals. It's really important to keep those in mind. Also, AMR needs to be seen in a triple planetary crisis context. It's pollution, diversity loss, and climate change. We are not alone with what we are trying to tackle here, obviously not. So again, what does it take? We need to look at the overall context. AMR is actually a vegetative problem, so it has multiple causes, effects, and it can't be solved with one discipline alone. And that's why, as it was said in the introduction, I'm really keen on transdisciplinary approaches to AMR. So it's a multi-sector and a multi-stakeholder problem. And to get a successful intervention, my recommendation, and many of you are working in the field, and today we are here because of that, it's a multi-stakeholder approach. So involve all stakeholders throughout your process of designing an intervention and implementing it. Think about, map out your stakeholders, involve them in the process, and get different perspectives. It takes longer at the beginning, but it saves time with the implementation, and it lowers the barriers for implementation. Of course, there are differing governance structures which need to be considered, and those may actually prevent rapid progress, but it is important to address them. From the start, and Tracy has mentioned the outcome measures, agree on data sharing approaches. It's really, again, very important. And overall, I think it is important to demonstrate to the stakeholders who are involved that this is a win-win scenario. because if one of them, there's something to win for everyone in there, and if one is missing, then we have like in a jigsaw, one piece is missing, the whole overall picture is missing. So you need a good team of collaborators which have sound foundation in their respective profession. And they need to also ideally be backed up by their respective professional bodies or policies. And today we're here because we have the quadripartite, which is tremendous, but also on the national level or subnational level or international level, there are other scenarios. So in Europe, because where I'm based, we have the strong support for the One Health agenda. And we have, for example, 5 agencies which just recently expressed their commitment to the One Health agenda, and that's the ECDC, the Chemicals Agency, Environmental Agency, Food and Safety, and the Medicines Agency. And if you look at that, it's really important that they come together and demonstrate the support for this. To start all your intervention development, of course, we need to think and know where the problem is. And I want to point out, of course, there's the surveillance pillar, but for interventions, you need to start somewhere. And so not know where the problem is, but then also have the outcome measures. And from that perspective, integrated One Health monitoring and reporting is important. And I wanted to highlight the UK One AMR report, One Health report, UK-wide. And in Scotland, we have the wonderful acronym SONAR, which tells you about the Scottish One Health antimicrobial use and resistance. And it's an annual report, and it's an invaluable resource of information on where to start and where the impact outcomes are, and or the intervention outcomes. And in that context, I want to again point out one initiative or project, the One Health Breakthrough Partnership. Again, it's in Scotland. And they are looking to minimize the impact of pharmaceutical contamination in the environment with specific focus also on AMR. And they provide a web tool for you to see combining presence of antibiotics in the environment and prescribing and consumption data. So there, again, it's a fantastic approach which can certainly help devising your interventions. Having said that, sometimes you need to start with having data gaps. So you have to think about the possibility that you haven't covered everything, but you need to start somewhere. Sometimes it's better to start rather than wait much longer. From my perspective, I know diagnostics is not included in the or wasn't included in the scoping, but I personally see it as an intervention, and it wanted to bring to your attention our DOSA project, the Diagnostics for One Health and User-Driven Solutions for AMR. We define diagnostics as a very broad term and think from the end, from the user, from the people who are impacted. So it's all about agency, about your own situation. A farmer, a shrimp farmer who doesn't know if there's antibiotics in the waters they are using, they will have an impact on their daily life. So for them to give them agency and give them tools, diagnostics could help. And that's a kind of an intervention, but it's always seen in the bigger package. And I want to wrap up with some examples, because it was mentioned that I'm also with JPIMR in the advisory board. Loads of scientific projects have been supported through JPIMR, and many have looked at interventions. So, for example, around stewardship, smartphone-based feedback support through digital stewardship. That's the AB Assistant project. AMR Resilience, it's an AMR intervention framework, again, providing support for multidisciplinary intervention. And finally, also a really exciting project about cost-effective ways to treat animal manure. So loads of examples, and if you go into those aspects which I've presented, I think you find more, and again, very happy to continue on that discussion. But I stop here for timing reasons. Thank you
very much, Till. And then, yes, indeed, I think that it's nice to know that there are many other, there are interventions that have been already proved impactful. And there is a possibility to get to know them, also looking a bit in details for the JPI AMR. Okay, so now we go to Christina. So Dr. Christina Osberg, she is a veterinarian epidemiologist, and she has a PhD in One Health and Zoonotic Diseases from the Swedish University of Agricultural Sciences. She has more than 15 years experience working in research, capacity development, and management of emerging health threats in low and middle income countries. She currently works as a veterinary advisor for the International Center for AMR Solutions, so ICARS, and she provides technical support to project formulation and implementation, and also including strengthening the research policy interface. So Christina, for you, it is that the question is, how can the AMR One Health Priority Research Agenda help to implement One Health intervention in low and middle income countries? Thank you.
Thanks a lot, Francesca, for the introduction and also for the participation, the invitation to take part of this panel. First of all, I have to say that just that interventions are given its own pillar in the One Health Priority Research Agenda shows the importance of doing more interventions and not sitting to wait for more data. We have to do both, generate data, and we also have to test interventions, what work and what doesn't work, and specifically in low and middle income countries that are facing the largest threats and burden of antimicrobial resistance. So I have 4 specific points to raise here, but the first one is that the intervention pillar is important in setting the framework for AMR intervention research and really pinpoint what are the areas of particular importance. And one benefit of that could be to use selected sections in this intervention pillar and incorporate that in some of the global resources, both for developing and evaluating the national action plan, One Health capacities, for example, the joint external evaluation, the performance of veterinary services, the global health security agenda, to really utilize this and incorporate it into those global frameworks. It's also really important and can be referred to when it comes to advocating for sustainable funding for interventions. The second one is that the intervention pillar really helps the research community to steer the direction when it comes to future research on interventions. So while interventions and research around interventions is really gaining more and more global attention, implementation research as a subject is generally very not well understood, and it's not widely adapted. So I'm very happy and pleased to see that implementation research is actually mentioned in this intervention pillar, because this pillar really helps to bring out the importance of implementation research, since that's a really applied type of research that helps to close the gap between research and policy. Also, as a third point, is that the intervention pillar stresses the importance of designing robust outcome measures for assessing the interventions. So while many researchers do interventions, the assessment and evaluation of interventions is not always there or very robust. So it's already listed the importance of including outcome measures on antimicrobial use and resistance, but also it stressed the importance of having outcome measures that go beyond that and involve evaluation, for example, of cost benefit, acceptability and scalability of interventions from a social, cultural, infrastructural, and also gender perspective, as some examples. And the fourth point is that which is also partly my opinion, that the intervention pillar should be seen as an overarching global priority list that countries and regions and sectors, they have to break down into target research questions that are really trying to tackle locally relevant and prioritized problems when it comes to tackling AMR. That's particular importance to low and middle income countries. Thank you.
Thank you very much, Christina. And indeed, I think that the intervention, it is the pillar that actually bring all together. So like there are also mentioning of the other pillar, but indeed, I mean, intervention can be of different nature and of, I mean, they are all important contributing to the final goal that we aim to reduce AMR emergence and circulation. Now we go with Professor Tong Zhang. So he is the chair professor in environmental engineering at the University of Hong Kong, where he also leads the environmental microbiome engineer and biotechnology laboratory. His research interests include environmental microbiome engineering, antibiotics and antibiotic resistance gene in the environment, wastewater-based epidemiology, and biodegradation of emerging pollutants as antibiotics. So the question for you is, like, based on your experience on AMR in the environment, what intervention do you see as a priority to tackle AMR in the One Health spectrum? Thanks.
Okay, thank you, Francisca. It's my great pleasure to get this invitation and to share my opinions here. And I think tackling antimicrobial resistance, the AMR issue in the One Health spectrum, requires multi-sectoral approaches that should consider human, animal, and environment health. The priority intervention in environment sector to address AMR, I think, should including the actions in different aspects. First of all, strengthening the surveillance and monitoring to have a more comprehensive understanding of the situation in different countries and areas. By doing this, we may know better about the current situation of antimicrobial resistance and antimicrobial residue and in the environment, including the water, soil, food, and air. And the two, now there are many powerful tools available, including the metagenomics and also sequencing of the isolates from the different environment sectors, plus the PCR-based diagnosis. I think that there are different tools can be selected, used for different application scenario. Secondly, we should improve the waste management. Obviously, strengthen the management of waste from the healthcare facility, pharmaceutical manufacturing plants, and agricultural settings will minimize the release of antibiotics and resistant bacteria and genes into the environment. One example is the special collection of the used pharmaceuticals at the household from the different households, just like what we are doing now will become more popular in different cities, the collection of the used batteries for some special treatment instead of just dump it into the landfill. And thirdly, I think in parallel to the waste management, we also need to improve the wastewater treatment management, especially enhancing the wastewater treatment of a healthcare facility, pharmaceutical manufacturing plants, and animal farms, and sewage of the urban area. Specifically, I'll give an example. Specifically, we should avoid the biological treatment of the wastewater from the pharmaceutical manufacturing plants. Now, the biological treatment of the wastewater of pharmaceutical manufacturing plants is still quite popular due to some the cost reason and traditional design. But it's not right if we look from the AMR point of view. If we cannot totally avoid this in a practice, we should use membrane filtration to filtrate the treated water so we can keep all the bacteria in the biological treatment reactors within the treatment facility, and then do the incineration of the bacteria so we can destroy them. And for the low income area, I think it's a priority. The first thing is to implement the collection of the sewage and also do the basic treatment of the sewage before discharge into the environment. These are the three aspects I think here with high priority, and all the different stakeholders could have the intervention to tackle the AMR problem in environment sector. For example, for the general public, and they should enhance the awareness and also education about the AMR issue. For the researchers and academia, we should encourage the research and innovation. And for the policymaker, implementing the policy and regulatory measures, that is very important. Of course, we should not forget some other interventions. like the strengthening the international collaboration and to foster the global collaboration and the coordination, just like what we are doing now. I'll stop here. Thank you.
Thank you a lot, like, for bringing up, like, okay, what can be done actually in the environment in the different sectors, but also like how important it is that, you know, what it is done well among the different people. Each of us has a role to play, and I think that I mean, as we always say, that AMR has no border. So I think that it is also everyone at local, but also national level and international level. We can all do our part. So now we go to our last panelist, so which is Professor Helen Lambert. So she's a professor of medical anthropology at Bristol Medical School in the UK. She uses interdisciplinary and ethnographic approaches to transform understanding of key global public health issues, including AMR and infectious diseases, from a One Health perspective, building on long-standing research in Asia into medical plurality, treatment seeking, and the inequalities in access to care. So Helen, for you, the first question is, based on your experience, what can be done to strengthen the cross-disciplinary and cross-sectoral collaboration and coordination for improving One Health research capacities? Thank you, and over to you.
Thank you, Francesca, and thank you for inviting me to be involved in this wonderful panel and the initiative more broadly, which I think is terribly important. Obviously, from my point of view, I feel that cross-disciplinary working is crucial for gaining the sort of holistic understanding of the drivers of AMR that we need, and for development and delivery of effective interventions. So finding ways to strengthen capacity in One Health research is really critical. I've been involved in research capacity development in public and global health for many years. And because as you know, and I think this is the case everywhere, but especially in low and middle income country settings, the systems that we use and the disciplines that we're trained in the educational system tend to be very segregated and siloed. So I think a very basic need is for enhancing outreach efforts and communication between academic research and implementing organizations, both in the government and in the third sector. We know that research collaborations, both between northern and southern countries and south-south collaborations, can be really fruitful. And we absolutely need this to create a sustainable research structure, as well as to share learnings, for example, in relation to the type of implementation research that Christina mentioned as being really important as a basis for development of setting appropriate interventions. My second point is a very simple one, which is that in doing this kind of research capacity strengthening, starting from a low base and not assuming understanding of one another's technical expertise or language is crucial when you're working across disciplines and sectors. So to take a very small example, as I know from my own experience, a term like consumption in relation to antibiotics may seem really self-evident, but the way that term is operationalized in surveillance or in the WHO, for example, is completely different from the way it's operationalized among social scientists. So we need to understand each other's terms and not make implicit assumptions when we work across disciplines. Thirdly, I think we can learn quite a lot from other global health challenges. Obviously, we know that AMR is a particularly wicked problem and especially complex, which is why we need engagement from all One Health sectors. But some of the issues, for example, we experienced at the beginning of the HIV pandemic, because it's so behaviorally influenced, it rapidly became obvious that social scientists needed to get involved in understanding the situation on the ground and how to intervene effectively. Likewise, the importance of assessing interventions and these issues about evidence, how do you know whether an intervention is working, that question about how to evaluate the effectiveness of population level change or particular interventions on overall prevalence is a problem, for example, if you're working on suicide prevention or if you're working on HIV. And so we can actually learn, although we tend to think of AMR as unique, we can learn from other global health issues. And finally, I haven't said that very much about cross-sectoral working. Obviously, it's critical in terms of this area. And I think the attention that's now being paid to the development of national One Health coordinating committees, which is being advocated, for example, in India, where I work a lot, is really important. And likewise, Till mentioned other planetary crises like global heating and the environment. And again, we can probably learn to try to put our heads together in relation to AMR as a One Health problem, as how to do this best across these other major global challenges.
Thank you very much, Ellen. And yeah, indeed, I mean, there is a need really to, well, to speak the same, to learn how to, I mean, to continue to be curious and to learn from the other. I think that it is like this kind of sometimes the terminology, which is different. I think that be humble always when you approach like a collaboration, which is at the basis. So now we start again the round. So, and for this time, I mean, we do have, for this second round of questions, we do have less time. So we start again with Tracy. So Tracy, for you, it is, in your opinion, what research is needed to establish criteria to assess success or impact of intervention for AMR prevention and control at One Health interface?
Thanks.
Over to you.
Thank you, Francesca. I think Helen just presented a perfect segue for this. I'm sorry. Yeah, so as the report actually says, implementation research, and I think Christina has also alluded to that. However, then the implementation research really does need to incorporate a formative type of research approach. Why? Because we really need to, as I said before, be sensitive to the context, yeah? Meaning we should bring out the qualitative as well as the quantitative data to be able really to percolate and explicitly show, you know, one, the socioeconomic factors in the emergence of disease that is leading to use of antimicrobials and hence emergence and spread of AMR. Number two, what is the cost benefit of actually these interventions that are being proposed right across the One Health spectrum? And something also that Dr. Zhang clearly brought out, the environmental considerations that are largely ignored, but now are coming, and not necessarily largely ignored, but we have not been able to explicitly state the different indicators and targets that, for example, you know, what goes out with the effluent into our different environments and actually now propagating AMR. So I think I just want to say, apart from saying that implementation research that really incorporates a the formative type of approach, it's already been mentioned, the cross-sectoral and sort of north to south and south to south exchange type of a research where we're learning from each other and humbly taking constructive criticism, while also including the social scientists that we have now time and time again learned that they bring out you know, the nuances that are largely ignored yet have a significant impact in how research will be taken up and actually scaled up to create the impact that is needed. Thank you.
Thank you, Tracy. And then we go to Till now. So for utilities, that how could this research agenda support the development of One Health AMR research proposals? So.
Yeah, thank you so much. This is a really important question. And I was going to say implementation research a couple of times. It has been said already, of course, and but I think that's what it is. It is doing what's currently already on the way, lead the way to raise the profile of implementation research to tackle antimicrobial resistance. And that can happen on multiple levels. And as a scientist, it's always about where is it attractive for people to go in and create their careers on. And I think if by this research agenda we raise the profile of implementation research, it becomes more attractive for people to join in and really put their efforts and their own careers on that. So that's on the size of people doing it. But then of course we need funding. Everybody needs funding for starting these types of works of devising implementation, putting them into action, proving it, and then scaling them up. That all this costs money. So raising the profile and then leverage funding. And this is obviously what the ambition is for the agenda. And I think you're doing the exact right thing, promoting it and taking the people who support it, the funders and overall supporters, but also the community who's engaging with it. So lead the way and promote that ambition to take implementation research into action.
Thank you very much. And indeed, I mean, it is one of the, I mean, we really aim that the research community can pick up this document to have ideas, but also to use it to advocate for their own project. Now we go to Christina again. So Christina, for you, it is, what is the most impactful intervention in your experience so far?
Thank you, Francesca. This is a very tricky question to answer in 2 minutes, but I will do my best at least to give a little flavor of it. Also, I have to stress that there's no one single place where you can find consolidated interventions that are assessed in various contexts and that are effective. So this is something, a repository, a library that will be, I think, of high global interest. Contextualization of interventions, we've heard that before by many of the panelists. It's important, I mean, when it comes to meeting the desired impact. We have to continue, of course, to reduce antimicrobial use and with the research and development of new antibiotics. But we also had to understand the different contexts. So, for example, recent research has shown that the association between antimicrobial use and resistance is actually less evident for the global south as compared to the global north. So in low and middle income countries, for example, infrastructural interventions, they seem more effective in mitigating antimicrobial resistance than reducing antimicrobial use. This includes interventions that really spans across the One Health spectrum and also links to the other global agendas such as climate change. Those are interventions for adequate sanitation, interventions for improved water sources, electricity, and so on. So we must not forget that. And we also have to remember that access to antimicrobials isn't universal. So in some areas, regions, and communities, we still need interventions that provide access to appropriate and good quality antimicrobials. And as a general note, interventions that focus on disease prevention are impactful, and they also have positive spillover impact beyond AMR mitigation. So interventions that are related to improved access and use of vaccines have been identified as a top priority for tackling AMR in Africa, for example. We also see when it comes to reducing antimicrobial use in the Norwegian salmon farming that the use of vaccines was really critical in bringing down the antimicrobial use to minimal level. Talking about food-producing animals here, we also see that interventions in feed and in water management are highly impactful, and across sectors that interventions related to coaching and mentoring for better practices have also been proven quite impactful. So on a general note, interventions that are focused solely on regulation without making sure that there is dissemination, the infrastructure in place are not that impactful. But of course, it has to be seen in the context and tackled that way. So those are my 2 minutes. I think I could talk about this for much longer.
Thank you very much, Christina. Yes, and indeed, I mean, I think that it's better to look at the intervention, which is more on like not the focus. I think that can have more benefit also for other things. And I think that this is what Tracy was mentioning, like, I mean, having a broad view. Thanks, and then we go to Professor Tong Tang. So in your opinion, what can be the innovative solution in the environmental sector to address overall AMR circulation across sectors? So more on the innovative solution.
Okay, thank you, Francisca. I think for me, there are many different innovative solutions in the environment sector to address overall AMR circulation across sectors. And first of all, I think we should construct the effective barrier between the different sectors at the interface of the sectors. For example, the advanced wastewater treatment technology. And to give you some examples of this, the membrane reactor, which use the membrane to filter out the bacteria, the pathogens, and keep all of them in the reactor, and to reduce the release of pathogens into the environment. And another is the anaerobic digestion, which can eliminate the pathogens under anaerobic condition and reduce the level of the pathogens in the final product. And also we can use advanced oxidation process. So we can, by doing all of this, we can reduce the discharge of antimicrobial residue and also resistant bacteria genes from the human and animal sectors into the environment sector. And also, of course, prevent them back to human and the animal sector again. And another is to reduce the selective pressures in the environment. For example, bioremediation. That means we use the microorganisms or enzymes to break down the antimicrobial residue in the contaminated site, in the contaminated environment. This will effectively reduce the selective pressure. And also another related innovative solution is the green pharmaceuticals. And by green pharmaceutical, I mean that they can be the environment friendly antimicrobial agent, which they will degrade more rapidly in the environment and reduce the environment ecological impact, reduce the impact on AMR. Additionally, we can also consider the precision agriculture using the technologies to optimize the use of antimicrobial agent in the agriculture, reduce the unnecessary usage, and minimizing the environmental contamination. And for sure, by remediation, green pharmaceutical and precision agriculture, we may lower down the selective pressure directly from the antimicrobial resistance, antimicrobial reagent. And in addition to the direct selective pressure, some environment pollutants may also promote the AMR by code selection. For example, heavy metals. I think any innovative solution which can reduce the concentration or level of these environment pollutions will also help to tackle AMR in general. And there are some other potential innovative technologies, like the phage treatment, just like phage therapy. I think we can investigate the potential of using phage, which can target specific bacteria for the targeted treatment of the pathogens in the animal manure to convert animal manure into fertilizer with lower risk. And additionally, I think development of natural alternatives to the antibiotics will be another way. For example, we can mining the herbs like the Chinese medicine to promote the use of natural compounds as alternative to support the plant health and growth, reduce our dependence on the antimicrobial in agriculture, so we can reduce the release of antimicrobial reagent into the environment. I think this basically different innovative approaches or method which can help us to solve this problem. Thank you. I'll stop here.
Thank you very much. And I hope that someone will pick up some of these, like to see how effective they are in the different settings, so we can have more information. Now, Helen, so for you, it is the last question of the second round. So it is, how can we improve early adaptation and innovation to tackle AMR across human, animal, plant, and environment sector in low and middle income countries?
I think not much of what I wanted to say has already been said by Tracy in relation to the importance of translation being sensitive to the specific setting. And I completely agree that undertaking formative research that includes qualitative work to identify factors beyond individual behavior or the microbiological environment is essential. And it feels to me that it's quite important for influential international bodies and governments and organizations like FAO, WHO, to highlight that we can't necessarily assume the transferability of any models or guidelines or approaches that have been developed elsewhere, because they will require adaptation to work in a different setting. So I think emphasizing flexibility and trying to develop frameworks or conceptual approaches that are not formulaic is really valuable. There's always a temptation to do that, especially in resource limited settings, because it seems it's cheaper and may seem easier just to implement something off the peg. But funds that we spend on ineffective interventions or ones that may even have unforeseen adverse consequences is ultimately wasted money as well as wasted time. I think I would also just like to mention a potential distinction between implementation research versus formative research. I think implementation research, as we've all agreed, is extremely valuable, but particularly when the evidence is already in place, for example, from a trial or other existing work that suggests that a particular intervention could work, but you need the implementation work to adapt it appropriately. I think formative research is a little bit more upstream than that, insofar as it helps us to actually find out what's going on and to have input into the design of the intervention itself, rather than just how to implement an existing intervention. So in terms of what we do, it's difficult, but I just think actually putting more examples out there of the difference that this kind of research makes would really help to get this point across, where we can show from experience how that has been valuable in improving the effectiveness of any intervention that is then developed.
Thank you very much for this. It's kind of an idea. I think that it is true. Like, now we label up the different kind of research, and I think that not all people, they know the difference, and will be actually, it's important to understand this. So with this, we have closed for the different, the question that we had prepared, but now I hand it over to Jorge, which was monitoring the Q&A section. Over to you, Jorge. And thank you very much to all the panelists from my side. It was very interesting.
Thank you very much, Francesca and panelists. Really nice discussion. So I will move to the Q&A session. We have, please provide your questions now, if you have, and we are going to start with two questions that we have. The first question is, countries are facing challenges to translate research findings into policies. How can the quadripartite support the countries to interpret data into actions and interventions? This is really good questions. Of course, we are doing a lot of work in activities. First, I think that we need to take into account that we are working from the high-level perspective to get this more government commitment and actions to implement the National Action Plan. And for the other side, we are also providing support to implement the activities, to increase the capacity in countries to implement the activities in the different National Action Plans. We also have a specific research pillar that will be the last one of this webinar series. And I think that will be in April. And we will expand a bit on this. But again, quadripartite is supporting different activities. We have different tools. You can find also in the link that I will share later on the quadripartite joint secretariat. I will move here to Elizabeth. If you have additional comments, Elizabeth, over to you.
No, maybe I just thought that, I mean, for sure, we need to try to link a bit between the research that was told also by the panelists, the research to policy. This is not an easy task, but we should have also an opportunity with United Nations General Assembly, where AMR should be on the agenda in September. So we hope to have possibly, hopefully, something about research as well. That's for sure. The whole agenda is aiming for helping to get to policy implementation at the end. It's not research for research. But as Jorge mentioned, I think maybe we should re-ask these questions after the next one, because the pillar is it's the last one on policy. So I think that will be a cross-link between what from the policy side is basically expected and can be done to take into account the questions. There will be some answers on this pillar. Thank you.
Thank you, Elizabeth. And the second question is for Teal. It's about to come out definitive conclusion through research. The time frame of 2030 could be too less. Perhaps 2050 target with 5-yearly intervals for assessment of progress may help better. What do you think, Teal? Over to you.
Absolutely. I think it's the you have to have a timeline, I think overall, but I think it depends very much on the each situation of if you think about the interventions on the wide spectrum they can have. So I would definitely say that there is scope for intermediate reviews. So yeah, it's dependent on the specific aspect one is looking at. But you need to start somewhere with the assessment. I think it's it's better to have a medium-term scope rather than starting with a too long vision, because it's very hard to otherwise keep track in the intermediate milestones and making adjustments.
Thank you very much, Teal. Let's go with the next question. What best alternatives to antimicrobials are researchers and policymakers will be providing to especially rural farmers in low and middle income countries? Francesca, maybe you can comment on that, or?
Yes, but I will. Oh, okay. Yes, I mean, let's say that we do have, as it was also mentioned from Tracy. Let's say that we try to have also some more broad approach, like for example for the farm field school. So it is not only like alternatives as, let's say, another drug or another compound that can be given. So actually having like improving the biosecurity or like other different aspects in order to avoid that there is the use of antimicrobials. Because I think that we should not, because I think that we have, I mean, let's say in the human history, there is always like, it's not always good to come up with something new to replace something else. So it's better like to have a more broad approach, try to avoid to use something because you do not even know like what can happen with this. And maybe, I don't know if Christina also want to complement, because they do have activity also that they have done for the farmers. Over.
Thanks for the question, and thanks, Francesca, for handing it over. I mean, you already touched upon the disease prevention, which is critical. I mean, vaccination, trainings, and so on. But there are alternatives such as prebiotics and probiotics. Some research shows they are not all of them are effective, but you really have to look at the ones where there's sufficient evidence. And once again, we need much more intervention, implementation research on those. Also, some plant-based drugs that have been proven successful as an alternative, and different therapy protocols also, where you combined antibiotics with analgesia, for example, which is critical. Bioactive proteins, peptides, but also simple things like chlorinated water, making sure that the feed is not contaminated. I mean, I would say there's not one quick fix. It's a combination of actions that are required at farm level. And I think more research is needed, but there's some evidence already out there on what works really as alternatives.
Thank you,
I don't know
Francesca.
if
Christina.
maybe also Professor Tong Zhang want to complement for the environment side, because he was touching upon this.
Okay, I agree with Christina about the probiotic, and also some other product can be used. I think for some natural product, they also can be further developed. And although, you know, at this time being, we do not have this kind of specific name of this kind of product for to provide to the low-income countries, yeah, for the use. I think at this time being, I do not have the specific suggestion on this. Thank you.
Thank you very much. The next question is, are any protocols or guidelines available for surveillance of AMR at the wildlife-human interface? I would like to share that the quadripartite is working with the quadripartite technical group. It's a group of experts. They are developing the quadripartite guidance on integrated surveillance with the One Health approach. So this is under development and will be published in the coming month. And this is a big effort because it's the first global guidance, including surveillance on the different interfaces of the different sectors in the One Health scenario. I will give the floor if someone else would like to make some comments on these questions about protocols or guidelines on surveillance.
Maybe I can add something on this.
Yes, please.
Yeah, I think for the protocols to the surveillance of AMR at the wildlife and the human interface, I think there are different approaches could be chosen. It depends on the technology availability and your area or country. First, for us, I think now metagenomics is very powerful too, and of course, together with quantitative PCR, and that's for the environment sample after directed DNA extraction. And also, you may work on the isolate to do the isolate after isolation. You also can do the MIC and also do the sequencing of the bacterial culture. So that could be the different protocols.
Thank you, Tom. I will continue with you because I think that the next question is for you. How could we think One Health intervention on AMR in countries with poor waste disposal, clean water, and food shortages issues?
I will comment on the clean water part. I think, of course, clean water is very important. If we look at the past over 100 years history of human being, our human life increased by 30 years, from beginning of last century to the end of last century, and the lifespan from 38 to 68. And one of the more important technology advance is the water treatment technology. That means the disinfection of the water before we drink it. I think on some areas, they may not have the centralized facility to treat the water to do the chlorinization or disinfection of the water. But still, as household, people can use simple way to kill the bacteria before drink it, like the boiling. If they can boil the water, heat the water, and they can kill most of the pathogens. And this will largely reduce the risk to get infected and also reduce the use of the antibiotic. So basically, that's my comment on the clean water part. I think for waste disposal and food storage, I'm not expert on that. Yeah.
Thank you very much, Don. Christina or Helen, do you have any comment on this question?
Well, yes, I mean, I suppose I'd certainly agree with the point that Tom has made about clean water and essentially providing safe water supplies and managing waste better, as far as I'm concerned, are One Health interventions on AMR. We've been doing some research, a comparative study in a urban area with a lot of pharmaceutical industry and another urban area with no industry, and we find high levels of fecal contamination in slum settlements in this poor urban setting, albeit with high levels of antibiotic use. But you can see the difference. My microbiology colleagues can see the difference in the fecal resistome. And in a setting like that, I would argue that, as I think Christina did earlier, that possibly addressing the high level of antibiotic use without prescription is less important than environmental improvement. Because, of course, antibiotic use is the quick fix that people resort to when they're poor and they have high levels of infection. So in those sorts of settings, that kind of preventive approach is probably really important for AMR.
Thank you, Helen. Tracy, over to you.
So my thinking is we have in our different countries, we have different levels of financing. And I think one of the facilitators also mentioned about financing. And unfortunately, you tend to find this, even within the countries, the financing itself is not equitable. In all honesty, to get this, as the question has asked, we have the poor waste disposal, issues of clean water, there's food shortages, including poverty. Then we need to package the data that comes from our research in a way that our policymakers understand. And not only that, try and tie it and tweak it to the different sustainable development goals that our heads of states and governments clearly understand. So if you look at the facets that have been mentioned here, the clean water, food shortages, etc., are all tied to one SDG or the other. And of course, overall, when you look at this platform, then you have the SDG 3 really encompassing everything, where we want just a healthy population. So I believe that the best way then would be to really take the research that we're talking about here, package the data into digestible information, depending on your target population, and then from there also just make sure it's linked to the SDGs, such that then the key influence, the key policymakers or the key decision makers are able to then channel financing, and even if it means tapping into the different levels of financing that are already available, so as to address AMR from a One Health lens, then that's how I think it really has to go, and then it will be sustainable also at a country level. Thank you.
Thank you, Tracy. Christina and Till, can you make your comment in 1 minute? Thank you.
Yes, I will try to. So to address that comment, it's critical to also mention that we will have a huge food security and food safety problem in the future if we don't tackle AMR now. So because if we don't have a capacity to treat diseases in animals and plants, it means that they will be much more expensive in the future. So that's why we really need to tackle it here and now. I think for all your questions regarding One Health interventions across waste disposal, clean water, and food shortage, it's important to design interventions where researchers and policymakers sit together and try to define the research question. so that there's policy involvement from the very early start of designing interventions. And there's a plan in how the results from the research will be used to inform policies, legislation, and for scale up of these interventions. And I think that goes across all these different fields, such as waste disposal, clean water, and food shortage. Now over to Till.
Yeah, thank you. So I think this is a fantastic question, which encompasses the whole One Health AMR challenge, because it touches on all these aspects which we need to consider. And just to be very short, so this is also always a kind of a conflict of interests of the different stakeholders in there. If you look at food shortages, this is such a pressing issue. One could say, okay, we give in here a little bit, and then because that's so important, we prioritize that, and AMR is falling back, so, and it has a lower priority. We must not do this, because we now understand increasingly that there is such a connection between the individual sectors that we can't just individually look at one. And as Christina said, it will be increasing in importance. And if we lose the ability to produce food due to AMR, that will have a negative impact. So beware of short-term fixes, look at the long-term, also with the question on the scope, which has been asked before. Long-term vision is important.
Thank you very much for this discussion. Really, really good. I will move to Elizabeth to close this webinar, and thank you, the panelists, and Francesca for moderating. Over to you, Elizabeth.
Yeah, thank you very much to all of you, also for sure to the panelists and the participants. I would just, in 1 minute, try to take notes to make 3 points that I got from the panelists. There were common proposals and common comments. There was this mixed bottom up and top down. For sure, our organizations are coming from the top down, and we need you to also get the bottom up approach. I mean, that's really critical to link these two sides. And it's also the link between research and policymakers. I think that is really something that we will have to follow. The second point that I had, and there was much about implementation research, the need for social scientists. That allowed me to refer to the next meeting that we will have, because there will be the meeting on behavior change, behavior insights and change. We should have the social scientists there. So it's a 6th March, so that allows me to go for this one. And the last point that was made, I mean, there were many others, but there was really something important about sharing experience and sharing examples. So we hope that we will be able, from the quadripartite with the Global Research Hub, to set up such a possibility to follow up what is going on research on One Health. And there was a point about digestible information, and that was mentioned several times in different words. Tracy used this digestible information. I think it's lunchtime, so that's maybe was inspiring me a lot. It's not only to stakeholders, but also to policymakers. There were these 2 flows that were mentioned to make us understood, to make the results of the research and also the aim of the research understood by the ones. When you've spoken, Tracy, about education, I think that's was really interesting point. And also where at the very end to the policymakers, because we will need support, political, but also money. And I will stop here because we're already 3 minutes over time. Thank everybody again for these fruitful discussions. And it's usually towards the end that we really start discussing. So we'll see how we can follow up to go deeper in these topics. Thank you very much. Yes, I think that's the important one, the next 2 dates here that Jorge just put on the screen. With this, I've finished, and I think, yeah, we are quite on time.
Thank you very much, Elizabeth.
Thank you.
Thank you, everyone.
Bye.
Thank you.
Thank you.
Bye-bye.
Thank
Bye.
you, everyone. Bye-bye.
Bye-bye. Bye-bye.
Bye to everybody. Bye.
Bye.